Good morning, everyone.
The continuations of obstetric and gynecological MCQ. Question number 91. Mammalic gland in mammals are modified. Option A salivary gland, option B lacrimal gland, option C sweet gland, and option D sebaceous gland. यो क्वेशन्समा कन्फ्युजन हुन सक्छ। म्याक्सिमम अथरहरूले के भनेको छ कि म्यामेलिक ग्ल्यान्ड इन म्यामल्स आर मोडिफाइड बाई सेबेसियस ग्ल्यान्ड र धेरैजसो रिसर्चहरूमा दिएको छ अथरले भनेको छ कि म्यामेलिक ग्ल्यान्ड इज मोडिफाइड बाई स्विट ग्ल्यान्ड। यसको बेस्ट एन्सर अप्सन सी हुन्छ, स्विट ग्ल्यान्ड, किनभने म्याक्सिमम रिसर्चमा चाहिँ यो भनेको छ, इम्प्रुभ भएको छ कि म्यामेलिक ग्ल्यान्ड चाहिँ स्विट ग्ल्यान्डबाट मोडिफाई हुन्छ। Best answer option C. Question number 92. Breast is composed of option A glandular tissue only, option B connective tissue only, option C connective and fatty tissue, option D glandular and fatty tissue. Breast are composed of fat, glandular tissue and connective tissue, which arrange to form lobes of breast. Glandular and fatty tissue. Option D. Question number 93. The cause of change in a size and appearance of breast during pregnancy. Option A. The breast changes are due to the secretion of estrogen and progesterone. Option B. The breast becomes stretched because of the weight gain. Option C. The increased metabolic rate cause of breast to become larger. Option D. Cortisol secreted by the adrenal gland play a factor in increasing the size and appearance of breast. During pregnancy, progesterone and estrogen secreted by corpus luteum and placenta cause the alveolar and ductal growth to complete the breast development, also produce colostrum. The best answer is the breast changes are due to the secretion of estrogen and progesterone. Option A is the right answer. Question number 94. A 19-year-old woman gives birth to her first child. She begins to breastfeed the infant and continue breastfeeding for almost a year with no difficulties and no complication. Which of the following cellular processes that begins in a breast during pregnancy allowed her to nurse the infant for this period of time? Option A lobular hyperplasia, option B stromal hypertrophy, option C epithelial dysplasia, option D steatocyte atrophy. The right answer is option A globular hyperplasia. Question number 95. Which of the following is the functional unit of breast? Option A ampulla, option B mycelium cells, option C acne cells, and option D lactiferous duct. Acne cell is the functional unit of breast. Option C is right answer. एउटा ब्रेस्टमा 12 देखि लिएर 20 सम्म चाहिँ लब्स हुन्छ र इच लबमा 10 to 100 लोबुल्स हुन्छ. Lobules contain alveoli which are lined by acne cells which secrete milk. So acne cells called functional unit of breast. Question number 96. The structure most directly involved in production of milk are option A papillae, option B glands of Montgomery, option C acne cells, option D lactiferous sinuses. The structure most directly involved in the production of milk are acne cell. Option C. Question number 97. Which is correct instruction given by nurse related to breast self-examination step? Option A. Perform breast self-examination monthly, 7 to 10 days after menses. Option B. After menopause or hysterectomy, perform a fixed day of every month. Option C. Use opposite hand to examine breast. Option D. Not take bath and use soap before breast self-examination. एभ्री मन्थ आफ्टर मेन्सुरेसन 7 to 10 डेजसम्म चाहिँ गर्नुपर्छ। मेनोपज एन्ड हिस्टेक्टोमी भएको वोमेन्सहरूमा एउटा डे चाहिँ फिक्स गर्नुपर्छ र प्रत्येक मन्थ त्यही डेमा चाहिँ ब्रेस्ट सेल्फ एक्जामिनेसन गर्नुपर्छ। अपोजिट ह्यान्डले ब्रेस्ट सेल्फ एक्जामिनेसन गर्नुपर्छ। तर कुनै किसिमको यसमा रिस्ट्रिक्सन छैन कि बाथ गर्नु हुँदैन, सोप युज गर्नु हुँदैन। सो एन्सर अप्सन डी हुन्छ। Question number 98. Breast examination should be performed in a female patient. Option A at the onset of menstruation. Option B during ovulation. Option C after menstruation. And option D during menstruation. After menstruation, 7 to 10 days. Option C is right answer. Question number 99. The screening cancer detection test for the most common cancer in a woman is option A biopsy of cervical tissue, option B dilation and curettage, option C positive Kehan's test, and option D breast self examination. The screening cancer detection test for the most common cancer in a woman is breast self examination. जुन आफैले गरेर चाहिँ आइडेन्टिफाई गर्न सक्छ। Option D. Question number 100. The process involved in the development of a mature ovum is called option A fertilization, option B oogenesis, option C gametogenesis, and option D spermatogenesis. यो क्वेसन फन्डामेन्टल्स अफ रिप्रोडक्सन्समा आउँछ। The right answer is option B oogenesis. Oogenesis is a developmental process by which the mature human ovum, female reproductive cell, is performed from ovonium, a primordial cells from which ovum is formed. Question number 101. During process of gametogenesis, the female and the male sex cells divide and then contain. Option A diploid number of chromosomes in their nuclei. Option B ahaplioid number of chromosomes in their nuclei. Option C 24 pairs of autosomes in their nuclei, and option D 46 pairs of chromosomes in their nuclei. A haploid number of chromosomes in their nuclei, option B is right answer. Ova in female and spermatozoa in males called germ cell or sex cells. Germ cells or sex cells means cell whose function in the reproductions of organism. Sex cells usually has a single set of chromosomes in their nucleus. Question number 102. Flashy released human egg has option A 2 X chromosome, option B 1 Y chromosome, option C 1 Y chromosome and 1 X chromosome, option D 1 chromosome. 1 chromosome, option D. Question number 103. What is the number of chromosomes present in gamete of human beings? Option A 3 set of chromosomes, option B 22 pairs of chromosomes, option C 1 set of chromosomes, and option D no chromosome. 1 set of chromosome जसमा चाहिँ 23 pairs of chromosome हुन्छ। Question number 104. An individual has the maximum number of oocytes. Option A by puberty, option B at birth, option C by middle age, and option D at 12 weeks of gestation. The maximum number of oocyte at 12 weeks of gestation मा हुन्छ at the number of 7 millions. Option D. Question 105. Of the 6 to 7 million oocyte available, how many are released during ovulation? Option A 100 to 200, option B 2000 to 3000, option C 400 to 500, and option D 3000 to 4000. Option C 400 to 500. 106. The first evidence of a pivotal development in a female is usually manifest as option A onset of menarche, option B appearance of breast buds, Option C, appearance of axillary and pubic hair. Option D, onset of growth spot. The beginning of breast development or breast buds called thelage, which is the first sign of a beginning of puberty that occurred at the age of 13. एभरेजमा 13 देखि लिएर 15 इयर्ससम्मलाई लिन्छ। प्युबार्च भनेको हुन्छ डेभलपमेन्ट अफ प्युबिक हेयर. This is the next step. And onset of menarche is a last sign of a pubertal development in a female. Question number 107. The first evidence of puberty in a girl is option A, menarche, option B, thelage, option C, pubarch, and option D, pain abdomen. The first evidence of puberty in a girl is thelage, जुन 13 years मा हुन्छ. Option B. Question number 108. The correct sequence of development of puberty in a girl is option A, thelage, pubarch, menarche, option B, pubarch, menarche, thelage, option C, menarche, pubarch, thelage, and option D, thelage, menarche, pubarch. यसको सिक्वेन्स हुन्छ thelage, pubarch and menarche. Option A. धेरै इम्पोर्टेन्ट क्वेशनहरु छ. Question number 109. The diameter of a fully mature ovum is called option A, 100 microns, option B, 90 microns, option C, 130 microns, and option D, 140 microns. (130 microns). Option C. Next, about gynecology. Thank you so much.